Hello, this presentation is a review of Alzheimer's disease, and it was created by Carrie Ann Robinson, President, and myself, Sierra Schaller-Mahl, with Spring Arbor University. Currently, there are over 31 million cases of Alzheimer's disease worldwide, with an expectation of over 106 million cases in 2050. Alzheimer's disease is a chronic degenerative disease of the brain that reveals itself as impaired cognition, regression of behavior, disruption of coordination and mobility, interruption of thought processes and thinking with poor judgment, and a decreased life expectancy. Alzheimer's disease is classified into 3 stages as mild, moderate, or severe based on the degree of memory loss and cognitive difficulties. Alzheimer's disease is the leading cause of dementia, with 2/3 of cases of dementia being caused by Alzheimer's. It is the 6th leading cause of death in the United States. Prior to the start of signs and symptoms, neurofibrillary tangles and beta amyloid plaques begin to develop in the brain. The neurofibrillary tangles develop as a consequence of the plaques causing a disruption between neurons. This disruption between the neurons activates glial cells. Glial cells serve an immune function, setting off an inflammatory response. This reaction then forms the hyperphosphorylated tau protein. This protein then forms the neurofibril tangles. When the brain has impaired glucose metabolism, this can lead to the formation of beta amyloid plaques. Research is showing insulin resistance and diabetes has a correlation with Alzheimer's disease. There's also an increased deposition of cholesterol at the amyloid plaque sites. However, not all patients with these brain changes develop Alzheimer's disease, nor have progression of these brain changes. The primary risk factor for Alzheimer's disease development is age, as 1 in 3 seniors have Alzheimer's disease after the age of 80. Another risk factor for Alzheimer's disease development is a female gender, as 2 out of 3 cases are women. Medical history is also an important risk factor, as hypertension, diabetes, prediabetes with insulin resistance, elevated cholesterol, obesity, physical activity, oxidative stress, smoking, depression, and head trauma have all been shown to correlate with Alzheimer's disease development. Genetics also plays a key role in Alzheimer's disease development, as 40 to 65% of Alzheimer's patients have the gene apolipoprotein E4. There's also risk with apolipoprotein E2 and E3, but does not have the high incidence as the apolipoprotein E4. Other genes that account for Alzheimer's diagnosis risk factors include chromosome 21's amyloid precursor protein, chromosome 14's presenilin 1, and chromosome 2's presenilin 2. As there is no cure for Alzheimer's disease and limited treatment options, prevention is key. Exercise has been shown to decrease the risk of Alzheimer's disease by up to 50%, as it prevents deterioration within the brain and helps to maintain connectivity between neurons. Exercise also builds brain muscle and strength and potentially prevents falls. Diet has been key with Alzheimer's prevention, with a focus on omega-3 fatty acids. Omega-3 fatty acids promote synapse plasticity, enhancing cognition, including memory and learning. They regulate inflammation and oxidative stress, preventing neuron damage, and they also reduce the release of inflammatory cytokines, interleukin beta-1 and interleukin 6. There are 3 omega-3 fatty acids, ALA, EPA, and DHA. Studies of Alzheimer's patients have shown low levels of DHA in plasma. The vitamin B family and antioxidant vitamins C, D, and E with the Mediterranean DASH diet are also associated with better mental function and risks of developing dementia and Alzheimer's. There's currently explorations into cholesterol-lowering medications for Alzheimer's prevention. Diets low in calories have also been shown to reduce risks for Alzheimer's disease. For those who are surgically induced with menopause, estrogen replacement has also been shown to be a prevention factor for Alzheimer's disease development. Other factors for preventing Alzheimer's disease include social engagement by staying involved with family, friends, and social circles. Vascular health has also been implicated by managing hypertension, diabetes, and cholesterol levels, which can prevent the formation of amyloid beta plaques. Smoking cessation is also important for reducing the risk of Alzheimer's development. Reducing alcohol intake is also important as a prevention measure, as this prevents damage to the neurons. Cognitive stimulation has also been important, as being able to maintain stimulation within the brain helps to maintain the function of the neurons. Limited head injuries is important early in life, including headgear during sports, to prevent Alzheimer's development. Currently, there is no definitive screening process for Alzheimer's disease. The United States Preventive Task Force says there is insufficient evidence to recommend routine screening. This is likely due to limited treatment options and no cure for the disease. Therefore, early screening would have no impact on the patient outcome. Genetic testing to identify the APO gene can be performed, however, it's usually not covered by insurance and only done for research purposes. Biomarkers in the cerebrospinal fluid and blood include screening for amyloid beta plaques and tau proteins. This can be used for diagnosis. Brain MRIs can identify the beta amyloid plaques and the tau proteins. However, these are usually performed whenever ruling out for other causes of symptoms. Patients may have the plaques and tau proteins and the neurofibrillary tangles and not develop the disease in their lifetime. Cognition tests can be performed annually and are at the discretion of the provider. They're simple and cost-effective. One test is the mini cognition test, and it involves the provider saying 3 unrelated words at the beginning of the visit and having the patient repeat them random times throughout the remainder of the visit. This cognition test also includes the clock drawing, where a patient draws a circle and then is able to label it as well as put the hands and make it form like a clock. Patients with Alzheimer's disease progressively have worsening clock drawings. There's also a 3-minute test that can be performed called the Alzheimer's Dementia Screening Interview, the ADA8, as well as the Montreal Cognitive Assessment, which can be a 10-minute interview. These can also be performed by a nurse and kept in the patient's chart to monitor cognitive function. Alzheimer's disease puts the patient at further risk for weight loss, seizures, incontinence of the bowel and bladder, an increased risk for falls, including possible head trauma, and increased issues with safety, including possibly wandering away, becoming lost, starting fires, or other dangers within the home. Screenings after diagnosis. Currently, no treatments exist to prevent, slow, or cure Alzheimer's disease. Therefore, screening after diagnosis is limited. Alzheimer's disease can be a terminal disease, although it may take 10, 20, or 30 years for the disease to complete its course. Lifestyle after diagnosis. Shortly after diagnosis, there should be a home safety evaluation, and this should be repeated throughout the disease process. Items should be kept in the same place, and drawers and shelves can be labeled. It is important to unclutter the home as much as possible and not to move furniture. Remove rugs and loose floor coverings to prevent falls, as well as ensure good lighting and night lights throughout hallways and rooms. There should be locks placed on all the windows and doors to prevent the patient from wandering during the day or night. It is important to keep a routine and sleep schedule, and if possible, a handwritten daily schedule. This can be used as a cue and prompt for the patient to look back on if they become confused. A calendar and planner can be created for long-term planning. Installing grab bars in the bathroom, including the tub, shower, and toilet, is important as well to prevent falls and to assist with mobility and coordination. It's important to turn the water heater down to 120 degrees to prevent burns while cooking, doing dishes, or showering. Matches and firearms should be locked, and driving should be discouraged. Although exercise is an important factor for preventing Alzheimer's, exercise after diagnosis is no less important. Aerobic exercise by seniors has improved cognition and has also been shown to delay progression of the disease. Regular aerobic activity is recommended for 3 to 5 times a week for at least 30-minute intervals. Research studies have shown that exercise increases the size of the hippocampus, which is the portion of the brain responsible for memory. Exercise reduces the rate of gray matter shrinkage. Surprisingly, women have more gray matter than men. The gray matter is the outside of the brain. It uses 95% of the oxygen supplied to the brain. The gray matter is where memory, attention, awareness and consciousness and perception takes place. It's also where one thinks and produces language. The white matter connects the gray matter and the autonomic nervous system. So exercise reduces the rate of gray matter shrinkage, which can be very important for women. Exercise also increases cerebral blood flow, and it also releases neural growth factors. Just as exercise is important for preventing Alzheimer's disease as well as delaying the progression of the disease, so is a diet high in antioxidants, vitamins E, C, and D, a diet high in the vitamin B family, and a diet high in omega-3 fatty acids. Patients should see a nutritionist to discuss which foods are best for them for delaying disease progression. A diet should also be low in saturated fat, as cholesterol deposits are noted in amyloid plaques, and the diet should also be low in sugar, as high insulin levels are known to harm the brain. Loss of lean mass is associated with brain atrophy and cognitive decline, so it's important that the body gets adequate caloric intake to prevent muscle wasting. Brain-stimulating activities are also very important after diagnosis. While there are no cures for the disease or treatment to reverse current plaques and tangles, it is believed that the brain-stimulating activities, such as educational and social activities, form additional connections between neurons in the brain, compensating for impaired neural pathways. Brain-stimulating activities can include social day programs, which have structured activities for patients and are led by professionals. Music therapy has improved cognition in all patients with Alzheimer's disease. Johns Hopkins University performed a research study conducting a singing program with older dementia patients and found most patients had cognitive improvement. A more noted example of music therapy is in the documentary Alive Inside, where a 94-year-old man named Henry, who was previously only able to answer to yes or no questions, begins to recall past favorite songs and is able to sing along to many songs with an iPod. This led to the development of the program Music and Memory, which is currently in 50 nursing home centers. Although the man had been nearly mute for years, once the iPod started, he was able to sing along to many of his favorite songs and knew the words. New York University researchers have a program called Meet Me at MoMA, which is the Museum of Modern Art, where early and moderate stage Alzheimer's disease patients attend monthly. Data collected shows improved mood from attendees. In Seattle, Washington, a program called Time Slips was begun where artwork is shown to Alzheimer's patients. The patients are then asked to make up a story of what is happening in the picture. The program noted that many patients who previously did not communicate now interact with their family talking about what is happening in these pictures. Storytelling is involved, which creates activity, as well as pet therapy has been shown to improve and stimulate the brain. Medications can be incorporated into the lifestyle after diagnosis. However, it's important that patients understand that the medications are a temporary progression and they are not a cure. It has only been shown to reduce progression by 25% and delay nursing home admission by 6 to 18 months. The first group of medications are acetylcholinesterase inhibitors. These are for mild to moderate Alzheimer's cases. These medications prevent the breakdown of acetylcholine, which is a chemical involved in memory and thinking. Alzheimer patients are shown to have less levels of this chemical in the brain. Side effects can be nausea, vomiting, diarrhea, anorexia, dizziness, and weight loss, while keeping in mind that it is important that the patient maintains proper nutrition. If your patient is experiencing these side effects, this medication should be discontinued. The second medication is an N-methyl D aspartate. This is for moderate to severe Alzheimer's patients. This medication regulates glutamate. Excessive amounts of glutamate in the brain cause neuron death, and this helps to keep those levels suppressed. Side effects can include constipation, confusion, and sedation. If your patient comes in and says that their confusion is worse after taking the medication and they think that the disease is progressing, it is possible to cut the medication. Also watch for Alzheimer's who have food fear with constipation. If they're getting constipated, many will stop eating to prevent constipation. This also is not appropriate as we want them to make sure that they have good nutrition for their brain. These medications are also available as a combination pill. Perhaps the most important part after diagnosis is lots of very important decisions need to be made that many do not think of early on in a disease. While the patient still has the ability to make decisions, it is important for them to find support groups. Support groups will find those in the community who are also on this journey, and they can support each other. They can also help the caregivers support each other as well. Patients can learn of local resources to help each other throughout the duration of the illness. It is important for the patient to build a care team. The care team will include the spouse, family members, friends, neighbors, volunteers from church or other social organizations, the primary care provider, neurologists, counselors, and any other specialists. It is important that the provider encourages the patient to reach out in the community for support, as many are willing, but if they're not asked, they don't know of the needs. It is also important then for the patient to decide medical release of information. This can be for spouse, family, and friends, and it should be on the chart. This determines who can receive medical information or who may be denied information due to HIPAA laws. It's also very important to begin financial planning for long-term expenses. These expenses include in-home care, adult daycare services, medical equipment, medical prescriptions, and possible long-term care placement. A list should be made of current assets, debts, income, insurances, long-term care insurance, Social Security benefits, Medicare benefits, and veterans benefits. The next important decision is creating an advance directive or a living will. These documents will discuss what medical treatments the patient wants and what treatments the patient does not want. This will include talking about resuscitation status, intubation status, the use of long-term IV therapy for antibiotics or hydration. This will also include the discussion of a feeding tube placement, as many Alzheimer's patients lose the ability to feed themselves. The advance directive can also list a power of attorney, and this can also be a separate form. Once they are made, copies should be given to the attorney, family members, and the physician. Some people have the advance directive or living will placed in an envelope in a refrigerator, as that is one common area in all households that EMS services can go to for quick access to these records. Decision making is important. An appointment should be made with the attorney to set up a financial plan, including the power of attorney, to legally determine who is responsible for making legal, financial, and medical decisions on behalf of the patient. When planning, the term legal capacity is often discussed. Those who are put in charge for making decisions on the patient's behalf cannot do so until the patient has lost legal capacity. Legal capacity means that the patient can no longer make reasonable decisions and can no longer grasp consequences for their decisions. Although we're looking at a power of attorney for medical, financial, and legal, these can be 3 separate papers and have 3 different appointees. One person does not have to have all 3 responsibilities. Brain donation can also be discussed, as well as funeral planning. It's important that these decisions are made while the patient still has the ability to participate in this process. So who creates the standards for Alzheimer's disease? Currently, it is a partnership between the National Institute on Aging and the Alzheimer's Association. However, on May 6, 2020, an announcement was published on the NIA website that the NII is now joining forces with the National Institute for Neurological Disorders and Strokes. Together, they're creating a new institute called the Center for Alzheimer's and Related Dementias, which they're calling CARD. This will be opening on the National Institutes of Health campus in fall of 2021. The Alzheimer's Association is the largest nonprofit organization funding worldwide research aimed at prevention, treatment, and a cure. It's also a point of recruitment for study subjects. The Alzheimer's Association currently has $185 million vested in 540 projects in 30 countries. The Alzheimer's Association invested $100 million to the IDEAS project, which stands for Imaging Dementia Evidence for Amyloid Scanning. This scans the brain for amyloid plaques to better help diagnose Alzheimer's disease. The Alzheimer's Association started a study in 2018 known as the U.S. Pointer, investing $20 million into this project. The U.S. Pointer is evaluating lifestyle interventions to prevent dementia and Alzheimer's within the senior population. The Alzheimer's Association also works with organizations promoting research and assisting with funding. The Alzheimer's Association works with the Alzheimer's Association Research Roundtable, which is a group composed of the National Institutes of Health, the Food and Drug Administration, the European Medicines Agency, Health Canada, and other agencies that pursue treatment. The Alzheimer's Association works with the Alzheimer's Association International Society to advance Alzheimer's research and treatment, which is known as iStart. This pursues research related to the disease. The Alzheimer's Association also works with the European Alzheimer's Disease Neuroimaging Initiative, which is known as EADNI. This is attempting to standardize diagnosis and monitor disease programs. The International Alzheimer's Disease Research Portfolio, known as IDRAP, is a public database of research trials, and they coordinate funding for research between the National Institutes of Health and the Alzheimer's Association. The Accelerating Medicines Partnership Alzheimer's Disease, AMPAD, is a partnership with the National Institutes of Health, Alzheimer's Association, and other organizations looking for medicine to prevent and treat the disease. The Alzheimer's Association works closely with the National Institute on Aging for Alzheimer's research, including looking for preclinical stages of the disease with the recent use of biomarkers. Both organizations are currently performing the diagnostic studies and standards for this disease. Thank you.